you all to check us out in all those different venues. Um, so, first of all, I have some good news to share this morning, and I am going to not share it right now. I'm going to share it in just a couple of minutes here. But I did want to say that we have made a tremendous amount of progress in the state of Washington. We remain one of the top states when it comes to responding to this pandemic, and certainly one of the top states when it comes to vaccinations. But we also know, as Washington Ready, as we reopened on June 30th, we also had made very clear that this pandemic is not over, and we still have a lot of work to do to make sure that our state is protected from this horrific virus, this horrific pandemic. And that means that this last several miles, if you will, of this long journey is going to require accentuated effort from all of us. And we really want to just say that that is a journey that we are absolutely committed to, but we also need to work with our partners and our community members to really help us get through this last several few stages of this pandemic. We're absolutely watching disease trends, and we know that activities for people, rightfully so, and actually happily so, are increasing post reopening, and we are so thrilled to see that, because from a health standpoint, it's not just about fighting this pandemic, it's also about all the other activities that make all of us healthy, well, and safe. And we know getting back to normal not only is good for our physical health, but also good for our mental and behavioral and spiritual health. And we want to do everything we can to encourage people, again, to be outdoors with the great weather, to be able to, partake in physical activity, and certainly doing all the various things to help each other, again, through this very difficult time. We've had almost 457,000 cases of COVID-19 in the state of Washington, and almost 6,000 deaths. And I just think we can't remind ourselves enough that this has been a pandemic that has taken a toll on all of us, no matter whether we're on this side of the light at the end of the tunnel. This has been a long, dark tunnel that's just been very difficult, and we can't forget the people whose lives have been especially impacted, and the families and neighbors and others of those loved ones. Our trends are holding steady as of our most recent complete data, which is absolutely great to see. But we are continuing to monitor this, not just on a weekly basis, but on a daily basis. And I think that's really critical for us to just make sure that you all are aware and monitoring alongside with us. So as you can see in this epi curve here, as of July 1, our statewide case counts and hospital admissions were flattening, and this is just the case counts, this is not the hospitalizations, were flattening, and most counties were seeing the case counts either flatten or decline. We're continuing to monitor this trend for case counts, and as you can see, it's nicely gone down. It's hard to know what's happening on the very right of this graph. Like I said, it's flattened and it's holding steady. We are watching it closely to make sure we do not see any upticks. Obviously, if you do see an uptick, the concern or the question in everyone's mind is it a true trend or is it a simple uptick? And as you can see, even it may be hard to see, but right as you see the graph coming down, right in the early stages of June, you see there's a little uptick right there, but it was still coming down. And so it's just always a trend that we need to be watching as we continue to move forward with our work. And even a bit of uptick is okay, as long as it does not become a trend and start to reverse course. We are also watching variants and breakthroughs related to the variants and related to vaccines. And thus far, the breakthroughs have not been significant in our state, which is great news. These vaccines are safe, they're effective, and they're working. And that's fantastic. And we want to continue to watch that. But the other piece of information that's important for us to let everybody know is that the Delta variant has increasingly been a proportion of the variants that we're seeing. At some point, it was under 5% at the state, And now we are seeing just over 40% of our cases are related to the Delta variant. Again, we are not seeing that translate into breakthroughs from vaccines, which is fantastic, which means the vaccines are working. But I do want to emphasize that the Delta variant is something that we are now increasingly seeing in the state of Washington at just over 40%. It is not over 50%, though, and we are also watching the other variants as well. Again, a reminder to community members, the best way to protect oneself, no matter the strain, is to get vaccinated. It is to get vaccinated. And so we're getting a lot of questions from people saying, hey, what can I do? Or what about this variant or that variant? And we're saying, let us worry and focus on the variants. You focus on helping people get vaccinated. Please help us in this regard. And remember, if you're unvaccinated, really it still applies of masking and social distancing, because you need to be away from other people, because you are still yourself at risk and potentially at risk for those around you. So now we're going to move to some good news, and the pace of vaccinations absolutely has steadied and slowed. We know that vaccine progress is continuing, though, and we are approaching some really big milestones. And Lacey and Michelle will be talking about these as well, but I just want to be the bearer of good news today, because I always feel like I'm not. So let me provide some fantastic information to all of you. First of all, we are almost at 8 million doses of vaccines that have been given to almost 4.3 million people across the state of Washington. That is an incredible amount of work and progress, but we have made just an amazing set of efforts to get to where we are. If you all remember where we were in December and January, and where things seemed like we weren't exactly certain how it was all going to roll out, here we are, 8 million doses of vaccine given to 4.3 million people. And as I said, we are one of the top states when it comes to our vaccination efforts. And I just want to thank our partners, our local health departments, local health jurisdictions, all our partners on the ground. The local health departments have just been doing an amazing job, and I really want to thank them for all their efforts. Certainly our tribal vaccine partners, certainly all of our healthcare partners, our pharmacy partners, our business, private sector partners, everybody coming together and being part of this process, and this congratulatory 8 million doses given to almost 4.3 million people. That said, here's the other good news. Okay, see the slide. When you add in, again, as we've done every week, our DoD and our VA partner information, we have officially, and this is breaking news. So this is as of just maybe 5 minutes prior to the start of this press briefing. In fact, one of the reasons we held for just a couple minutes longer was we wanted to make sure we had this information. And we are now at 70% of the population 16 years of age and up has received at least one dose. And this is great news. And we knew we were going to get here. And I just want to remind everybody that we certainly had already met the goal, that the national goal that the president, federal government had set for 70% of 18 and up receiving one dose. We had well exceeded that weeks ago, and certainly are at, I don't have the exact number, but I believe we're at 75 or 76% when it comes to 18 and up has received one dose. But we have now hit the 70% mark of the population receiving at least one dose above the age of 16. And so I really just want to thank again all of our partners, and I want to thank our team. I want to thank Lacey and Michelle and Dr. Lindquist and everybody else on their team who have always been a part of this process from the beginning of the pandemic, but especially through the vaccination process. I also want to thank Sheann Allen. In particular, Sheann has been someone who doesn't get a lot of You've seen her on some of the press briefings. She doesn't get a lot of accolades because she's been a person behind the scenes, but she has just done an amazing job. And I just want to give a shout out to Sheann as well. And if I could do a clap on this, I would absolutely do that. But obviously, I can't quite do that on. Heck, I'm having trouble enough with my camera. So let's just make sure that I keep going here. So it is exciting to be at this milestone, and we know this excitement is shared by all of you, but we also recognize that there is more work to be done. This does not mean that once we get to 70%, which we have today officially, that our work is done and we stop and we go home and there's nothing else to do. This actually now underscores the efforts that all of us are engaged in. So let me show a few more slides, and I'm going to talk about that in a little bit more detail. More than, if I can go to the next slide, more than 3.9 million people are now fully vaccinated. So we're just shy of 4 million people being fully vaccinated. That represents almost half of our state. But that also means that half of our total population is still vulnerable, including, and this is really key here for parents, including all of our kids who are under the age of 12 because they are not eligible for vaccines. I think it's an absolutely important point that we want to emphasize with the CDC recommendations and guidance that came out on Friday that Lacey is going to be describing a little bit more in detail. We absolutely recognize that we have made so much progress in our population of 18 years and above, 16 years and above, and certainly 12 years and above. But those who are under 12 are still not eligible for vaccines, and we have to continue to redouble our efforts to protect our youngest in our communities. The next slide is very much the graph that I've shown multiple times, and I just want to go through this again, that we know vaccinations are working. They're not just working in the sense that these are vaccines and it's a theoretical working. We are seeing the data play out, that they are not just vaccines, they are protections. They are opportunities of getting someone protected from this virus. And so again, if you look at the trends here, the hospital admission rates on the left for those 45 to 64 and those 65 and above, again, and I'll help you with the math here because it's hard to see, but it's 18 times higher for the hospital admission rates for those who are unvaccinated in red here versus those who are vaccinated fully, and that's represented in the bottom green here. And for 65 years of age and above, it's 11 times higher hospital admission rate for those who are unvaccinated. Again, we want to make sure that we recognize a couple of things. As I mentioned, with the 70% mark that we have reached it statewide, that does not mean that we do not have pockets. And that means as large as counties, that may be in smaller census tracts, that may be in zip codes, that may be in neighborhoods where we have community members who are not at that 70% mark. And what that means is that there are individuals that are still not protected from this virus. And so while we've done an incredible job vaccinating individuals, we still have work to do. And that work is very much centered on doing everything we can to fill those gaps. Now, we know we may not be able to fill all those gaps, but we're doing everything we can to work with our partners on the ground to be able to, as we say, approach this, whether it's a last mile or last multiple miles, but to meet communities where they are. And so some of the efforts that we are accentuating our focus on, you've already heard about the caravan efforts, the community outreach efforts, and that has thus far been really an amazing, we've had just an incredible amount of support and interest from our partners in this caravan efforts, this community outreach work that we're doing. The second piece of this is the ongoing work that we are also going to increasingly focus on, which is working with our healthcare providers, because we know our healthcare providers are source of trusted information in the communities, and we are moving forward with an additional set of strategies, including an initiative that will really help us focus and work with our healthcare providers, again, who we do know are oftentimes approached by patients or clients or individuals for information on vaccines, and we want to help support those healthcare providers. I do want to make this other, before we let the slide go down, just a reminder, I've said this multiple times, that we do not want to see a tale of two societies, those who are vaccinated and protected in green, and those who are unvaccinated and thereby unprotected in red, and still seeing people who we could have prevented from getting ill, from getting hospitalized, or having a bad outcome, and those individuals not getting vaccine. So let me close with a few other things that we know that masking and other preventive measures still matter. We absolutely do not want to see our cases begin to rise again. Certainly we're holding steady again. If you're not fully vaccinated, again, that's a reminder, 2 weeks after completing vaccination, after the 1 dose of J&J or the 2 doses of Moderna or Pfizer, masks are still required in indoor public spaces. It's also a reminder that everyone is required to wear masks in high-risk settings like schools and childcare, healthcare, correctional facilities, homeless shelters, public transportation. That is still the case, but we also want to make sure that people are checking and respecting, as we've said, respect the rules of the room you are in that may be more stringent or more strict. Remember, wearing a mask doesn't mean that someone is not vaccinated in particular. We also want to make sure that people are respecting the choices that individuals are making who are fully vaccinated and choosing to keep wearing masks and during this transitional time. I'll be honest, you'll see me with a mask more often than not. And so I'm fully vaccinated, I've been fully vaccinated for months, but I still choose to still have a mask on in many settings. And I just want to make sure that we're also recognizing, one, respect the rules of the room you're in, whether it's the jurisdiction or it is the business or the establishment that you're partaking in. But number two is that you're also doing what you can to help fight this pandemic. And if you have not gotten vaccinated, again, I implore you to get vaccinated today. When we see the Delta variant at now 40%, over 40% of our cases, I cannot say enough about how important it is for everyone to get vaccinated. We do not want to see an uptick or an increase in our data in our communities, and most importantly in our people. What we want to do and what we want to see is preventing those illnesses in the first place. So our work is not over. You can still help. Please make a goal this week to talk to at least one, if not two, if not three, if not five, if not seven people, one person a day, who has not gotten vaccinated. Please help us in this effort. And really, we can continue to drive cases down and reach more people with vaccine if we keep working together. And I know we can do this. It's just a matter of all of us working again in the tireless efforts. And I want to thank again our media partners for everything that you have done throughout this pandemic, and certainly as we continue to move forward. So with that, I want to just say great news. We hit 70% milestone, and we still have a lot of work ahead of us. So with that, Corey, I will turn it back to you.
Thank you, Secretary Shaw. Next, we'll go to Deputy Secretary Lacey Fairmont.
Good morning, everyone. Glad to be here to share a couple of quick updates, and appreciate you joining us today. The first thing I wanted to talk about was testing. The number of tests performed here in Washington State has been declining in recent months. This is a trend we're also seeing nationally. Nationally, the 7-day rolling average of new tests has dropped by more than half since the beginning of April. In our state here in Washington, it's a little less. Our drop is about 40% during the same time period. We think the likely biggest reason is that there's less transmission due to more people having been vaccinated. Nevertheless, as Dr. Shaw said, the pandemic is not over. The virus is still here in our country and in our state, and getting tested is as important as it has ever been. Testing helps us track the spread of variants in Washington State, including the Delta variant. It also helps protect unvaccinated neighbors, students, families, friends, containing the virus, and preventing further spread and chains of transmission. Anyone with signs or symptoms of COVID-19 should seek testing, and that's regardless of your vaccination status or prior infection. If you are vaccinated, please make sure you let your provider know, and they'll evaluate if testing is necessary. The vaccines work very, very well, as Dr. Shaw mentioned, but breakthrough cases can happen in rare circumstances. If you're not fully vaccinated, you should also get tested if you've had close contact with someone with COVID-19 or you've taken part in activities that put you at higher risk, such as going to a large gathering or being in a crowded indoor setting. Is usually covered by your health insurance. No cost testing is also available to people who do not have insurance. COVID-19 testing is available in many pharmacies and other locations across the state, and we're always working at DOH to increase access to testing. You can find a test near you at DOH.
Lacey, it appears that we've lost audio for you.
Yeah, Lacey, we've lost audio. I thought it was me, because usually me, but it looks like it may be something going on your end. Corey, can you hear her?
Is that better? Can you hear me now?
We got you loud and clear now. If you could go back just about 20 seconds.
Did you get, okay, how about?
Why don't you go back to, as Dr. Shaw said, that vaccines are effective, and you can start there.
All right. As Dr. Shaw said, the pandemic is not over. The virus is still here, and getting tested is as important as it has ever been. Testing helps us track the spread of variants in Washington, including the Delta variant, and testing helps us to protect unvaccinated neighbors, students, family, and friends by containing the virus and preventing further spread or chains of transmission. Anyone with signs or symptoms of COVID-19 should seek testing, regardless of your vaccination status or prior infection. If you are vaccinated, make sure you let the provider know when you seek out testing, and they'll evaluate if it's necessary. The vaccines work very well, as Dr. Shaw mentioned, but breakthrough cases can happen in rare circumstances. If you're not fully vaccinated, you should also get tested if you've had close contact with someone with confirmed COVID-19, or you've taken part in activities that put you at higher risk, such as being at a large gathering or in a crowded indoor setting. The cost of testing will usually be covered by your health insurance, and no cost of testing is available for people without insurance. COVID-19 testing is available at many pharmacies and clinics across the state, and DOH is always working to expand access to low barrier testing. You can find a testing site near you by going to doh.wa.gov/testing. Again, that URL, doh.wa.gov/TESTING. The second thing I wanted to highlight is school guidance. As you all know, DOH released preliminary guidance for the 2021-2022 school year in May to help our schools and families across the state plan for the upcoming school year. We recently updated this guidance to clarify that students and staff no longer need to wear masks when outdoors in accordance with updated science and our Secretary's face covering order. Following that, the CDC released their updated guidance for the upcoming school year, and we are currently looking at that at this time. We appreciate CDC's emphasis on the promotion of vaccination and their recognition of the need for continued layered prevention measures to protect students, staff, and families, including some who are not yet able to be vaccinated. We are working with our school and local public health stakeholders, as well as the governor's office, the Office of the Superintendent of Public Instruction, and the Department of Labor and Industries on next steps. And we do expect to release updates to our guidance soon. And with that, a reminder that the most important thing we can all do to protect students in school is drive our transmission rates down. And we all can play a role by doing our part in that, which is to get vaccinated and use the measures we know limit the spread, such as wearing masks and watching our distance. So with that, back to you, Corey.
Thank you, Deputy Secretary Fehrenbach. Next, we'll go to Assistant Secretary Michelle Roberts.
Well, good morning, everybody. As Corey said, I'm Michelle Roberts, and I lead the COVID-19 vaccine planning and distribution team at the Department of Health. I want to start by saying how proud I am of everyone who's received their COVID-19 vaccine. Thanks to you, we're working to bring the pandemic to an end, and we've reached our 70% goal of initiation for everybody 16 and older. Our communities are safer and more protected because of all these Washingtonians. This milestone has taken months of hard work and dedication, and we do not plan to stop until we cross the finish line. If you haven't been vaccinated, now is your time. Across Washington, nearly 4.3 million people have received at least one dose of the COVID-19 vaccine. If you've got a 2-dose vaccine like Pfizer or Moderna, do not skip your second shot. While it's true one dose offers some protection, completing the series boosts the vaccine's effectiveness to 90% or more. With new variants on the rise, time is of the essence. Research shows COVID-19 vaccines offer protection against the variants, including the Delta variant, and widespread vaccination can prevent deaths and hospitalization. The more protected you are and the more of us that are protected, the better. When you get your first shot, your provider should make you an appointment for your second dose. For Pfizer, it's 3 weeks after the first shot, and for Moderna, it's 4 weeks after the first dose. If you miss this window, you should still get your second dose. The CDC says second doses can be administered up to 6 weeks after the first dose, and people do not need to restart the series. Once you get your second shot, you are good to go. Although there's been discussion about boosters recently, the FDA and CDC said people who are fully vaccinated do not need to worry about booster shots at this time. If and when science shows booster doses are needed, we will let you know. Now, let's end with some additional good news. One person in Washington will be $1 million richer, all because they got the COVID vaccine. This week marked the 5th and final week of the Shot of a Lifetime vaccination series. Data shows the lottery encouraged people to get vaccinated. Following the June 3rd lottery announcement, vaccination rates increased across all age groups. DOH estimates that the lottery increased vaccinations for people 16 and older by about 24%. And the giveaways aren't over yet. Up next, military members, staff, and their families who received at least one dose of COVID-19 vaccine through a military provider can enter to win up to $250,000. Drawings for a Hero's Thanks begins next week. More information, including how to opt in, is available at coronavirus.wa.gov. I want to end by saying we know that some people have questions about the COVID-19 vaccine. So please visit our department's frequently asked question page or talk to your healthcare provider. To make a vaccine appointment today, visit our vaccine locator website, text your zip code to Get Vax, which is 438-829, to receive nearby addresses of available vaccination sites, or call our COVID-19 vaccination number, 833-VAX-HELP. Thank you.
Thank you, Assistant Secretary Roberts. This brings us to the Q&A segment for today's briefing. With that, we'll go over and we'll begin with a question from Ariel with the spokesman.
Great, thank you. I have 2 questions this morning that are a bit different. My first one is, at what point will the Delta variant become a problem for the state? And sort of what signs are you looking for, whether that's an actual upward trend in cases or a substantial amount of breakthrough cases? And then my second question is, how many clinics have the caravans hosted, and how many more counties or clinics are scheduled in the upcoming weeks? Thank you.
Yeah, thank you, Ariel, for that, and hope you're doing well. Just a couple of things about the. Thank you for asking about the Delta variant, because I think this is a really important question. As we've said, that the Delta variant has increased from under 5% weeks ago to where we are today, which is now over 40%. That in and of itself is not cause for concern in and of itself. The cause of concern is when you see a few things. One, you start to see increases based on that variant especially in communities or places or sociodemographically speaking, where you have people who are unvaccinated, who are seeing the circulating Delta variant be increasingly part of what's making them sick. But the second is that where you start to see vaccines not working, or increase in breakthroughs. In other words, that the vaccines are not as effective because you're seeing more of the Delta variants in the breakthrough cases. And we're watching this on a weekly basis, actually watching it on a daily basis, but we're watching our variants very closely, not just for what's circulating in the state, but also what we're seeing in terms of breakthroughs with vaccines. And we're not seeing that increase yet, and we're hopeful that we don't see it with the Delta variant related to the breakthroughs for vaccines. So when you start to really get concerned, are, again, in summary, threefold. One is that you see an increase in the actual percentage of the Delta variant, which right now we're seeing that. But number two is when you're actually seeing that and it's now leading to clusters or outbreaks, especially in the unvaccinated, but in communities across Washington. And number three is when you start to actually see vaccine breakthrough cases that are increasingly due to a variant. Variants are not uncommon, and they're not unexpected. We know that variants are going to be part of the picture. Why? Because that's what viruses do, is that they mutate, and they change, they morph, and when they do that, then certainly we have to continue to stay ahead of the virus. So that's the first question. As far as the second question, and again, I don't know if Lacey or Michelle have an answer to this. What I do know is that we received 60 requests, I believe, to date when it comes to our caravans. As far as how many of those, there may be an update that Michelle or Lacey might have, but I do know that we've received 60 requests thus far.
Yeah, we were able to grab those numbers. So to date, there have been 20 event requests fulfilled. And like we said, or Dr. Shaw just said, there's 60 events that have been requested going out through the end of September right now. So we've had 20 so far, and 60 have been requested.
I did want to make one comment that we are, as part of this process, when we do get a request from for a caravan event, one of our initial checks is back with our local health department partners. And so there are events that we then may not host ourselves, and we actually then move that over to the local health department to be able to fulfill, to make sure that we stay coordinated with our local partners. But great question. Thank you, Ariel, for that question. Both of those questions.
Our next question comes from Nicole with Iowa Radio.
Good morning. So we're sort of in a weird time right now where the state has reopened, but yet the virus isn't over. So I'm wondering, at what point can we really say things are back to normal? At what percentage, or how far down the road do you expect this to be? A few months away? Where we can say, okay, we've really kicked this thing, we don't have to worry about it, there are so few cases? Or on the flip side of that, are we looking at a situation where in a few months' time we might have to go back to almost where we started because of this Delta variant, like we're seeing other countries around the world having to do?
Thanks, Nicole. I would say that one is that we are, you're right, we're at that transition point where we have reopened. We're watching the trends. Fortunately, the trends are still steady, holding steady, which is positive news for us. But we are at the same time mindful that there are still many people, many communities across the state of Washington that have not been vaccinated, or even they have not even received the first dose, let alone fully vaccinated. And so we want to continue to focus on that. We are also looking at this, behind the scenes, looking at both in terms of who we believe from a modeling perspective who has already been infected with COVID-19, as well as who has been vaccinated with the COVID vaccines, so that we can add together and see where we are, and again, try to do our best to project when we get to a safer place. We're not quite there yet, and I think we have talked previously about in this state that we have been so good from a standpoint of fighting this virus that we have actually have to really rely on vaccines, because we've had less people that have been infected than perhaps other places across the country. The reason I shy away from giving a number is that things are changing and evolving across the country. If you, and you know this better than I do, Nicole, if you look across the country when it comes to the media reports related to the Delta variant, especially in the southern states, there is a lot of concern right now for those counties that have lower vaccination rates. And also they are now seeing an uptick in cases, and a lot of those upticks are related and attributed to Delta variant. So that's really what gives me pause to give a number, because there seems to be some evolution of what's happening from the standpoint of this virus, but also the fact that there has been a slowdown across the country. And that's also occurred here in Washington, although we've been great at doing this, one of the top in the country on vaccines. And so this last set of the efforts that we're putting in to really do whatever we can to get people vaccinated is so critical. And I'm really mindful that we want to get people vaccinated over the next 2 or 3 months, because again, when the weather starts to get cooler, when we start to get people indoors, if people are not vaccinated, come winter, we're going to potentially have some additional clusters and outbreaks that could have been preventable. So I think that is another piece that's still in the horizon. The last thing I would say, and Lacey, Michelle, if you guys have anything you want to add to this, the last thing I would say is that we are likely going to be living with this virus for a long time coming. It is not going away anytime in the foreseeable future, and so it is really critical for us to keep that in mind and be ready for that. But also at the same time for us to get vaccinated and take care of the things that we can take care of. When it comes to emergencies, there are so many things that we cannot do. It's not in our control. It's not in our power. And so that really causes a lot of anxiety and stress. But as you know, there are things that we can do and that are within our control or our power. And that's really where we should be focusing as a community or set of communities, is what can we do to really, again, fight this pandemic. But I do believe that we're going to be living with this virus for a long time coming. Lacey, Michelle, anything you want to add?
I'd just add that, there is a global component to this. I mean, the health of all of us depends on the health of the entire world. And we are so lucky in the U.S. to have such a robust supply of the vaccine, and now to see our government share that supply with the rest of the world. But the virus will be with us until we see high vaccination rates across the world. We always say with vaccine preventable diseases, they are only a plane ride away. And we've seen outbreaks in the past of, including at places like Disneyland, where we have a lot of mixing of people from across the world. And so there's always potential. And so the best thing we can do is what's within our control, like Dr. Shaw said, and get vaccinated now. We have a plentiful supply of vaccine in the US and lots of different ways that people can go get vaccinated.
We have 2 reporters left in the queue this morning, so we'll move to Jake with King 5.
Hi, all. Thanks for taking our questions again today. We really appreciate it. The Snohomish Health District has been reporting what they're calling an uptick in cases, and Dr. Chris Spitters went as far as to calling it a 5th wave. I apologize if you touched on this at the beginning of the briefing. I was having connection issues, but is a 5th wave expected? Is that what you're calling it? And should we expect that with the kind of reopening that we're experiencing right now? And if you don't mind touching a little more on what you're predicting for the winter months with that in regards to that. Thank you.
Yeah, thanks, Jake. Honestly, when you look at what various local health officials have been saying, they're absolutely right that we need to continue to watch for clusters and outbreaks and increases in the local communities. And so we're completely supportive of what is being described as being increases in various jurisdictions. I wouldn't go as far as saying that. Again, remember, we're watching from a statewide standpoint, and we have not seen the trend statewide because we've had such great uptake of vaccines and the receptivity for vaccinations has been so strong statewide. We have not seen what you characterize as the fifth wave. What we're seeing is really things are holding steady. But obviously, we've already been through the first, the second, the third, and the fourth. And there is always a chance that we could see not just an uptick, but an increase over time. And if that happens, I would attribute it to two factors. One is that people are forgetting that we're still in the pandemic. And so we have to make sure that we remind everybody that while it looks like everything is back to some level of normalcy, it is not. And number two is the fact that we simply are not getting vaccinated and making sure that people are protecting themselves. And if they're not vaccinated, that they're still wearing their masks and still keeping their distance as if they were pre-vaccine. They're still in that same era of where we were last year in order to protect themselves and those around them. But we also recognize that just getting everybody, as many people vaccinated, this is particularly a concern around children. Again, I want to emphasize that, again, those who are under the age of 12 are just not eligible for vaccines yet. And we hope that's going to change sooner than later. But in the meantime, that means that we have to continue to watch the trends, including with our kids, because if we start to see increases in kids, that is also a potential concern for us. So, what you're describing as far as what we may see in the fall or the winter, who knows? There's really no good modeling forecast for that. We're seeing the case counts holding steady statewide. We are seeing some upticks in certain areas, and usually that's related to the vaccination rates being lower in those very areas, and/or people just not following the protective measures that they need to if they're not vaccinated. But in the winter, we are concerned that if we don't continue to get people vaccinated, if people don't roll up their sleeves, they're unprotected. And once everyone is eligible, essentially 6 months of age and up. Right now, it's obviously just 12 and up. When everyone is eligible, then we'll really get a feel for how many people are fully protected from this virus, including our children. Let's hope we can get to that race before time, before the winter, because if we do not have vaccines that are available for kids before the winter, or we start to see people again not getting vaccinated, or we start to see vaccine breakthroughs, or we start to see Delta variant or other variants that are increasingly of concern, you put all of those ors together, and now you have a concern for what might potentially happen in the fall or the winter. And so we want to avoid all that. As I said in that second question to Nicole, that really at the end of the day, there are some things that we can't predict. We can't worry as much about, and we're certainly concerned about it. But really what we're most focused on is what we can prevent, what we can do, which is really about the preventive measures, especially vaccination. So I hope that helped. I know it was a long answer, Jake. I know you had connection issues at the beginning, so I wanted to make sure to give you a more complete rundown there. And I don't know if Lacey or Michelle, if I missed anything. Okay, Corey.
All right. With that, we'll move over to Ryan with KUOW. Go ahead, Ryan.
Good morning. I have a question about 70%. You guys talked about crossing the finish line. I think that was in reference to 70% of people getting their second final dose and being fully vaccinated. But we know that, this number doesn't provide some magical anti-COVID blanket. It's one better than 69, and it's one worse than 71, I guess. So how was the number or the metric 70% reached? And why should the public care about this seemingly arbitrary goal?
Well, thanks, Ryan, for that. And you certainly brought it to reality, right? Which is exactly what I think our point is, that we had a couple of numbers, and I just want to clarify this first, the numbers, so that we're on the same page. This is not fully vaccinated. This is at least one dose of vaccine. So again, in the case of JJ, then that means the individual 2 weeks later is fully vaccinated. In the case of Moderna or Pfizer, it's one dose, so it does not mean fully vaccinated. But if this is, there are two 70% milestone numbers that are out there. One is the 70% that was set by the president. President Biden had set a goal of 70% of all adults 18 years of age and above to have received one dose by, I believe it was 4th of July was the goal. And so we at the state of Washington met that goal. There was then a second goal that we had set for related to reopening. And that goal was that we were going to hit the 70% mark of those who were 16 years of age or above having received one dose. So that was a second goal that was set. And over the last several weeks, we've actually increasingly gotten a lot of questions from our media partners about the second goal. And then at some point in between, there was a confusion between the president's 18 plus goal and the state set 16 plus goal. And so we then increasingly made sure that we were, one, spending a lot of time in clarifying the difference between those two goals, and number two, where we stood with respect to both goals. So if you look at our website and or social media, you'll see a nice kind of a graphic of the state of Washington, and it tells you the 16 plus goal, the 18 plus goal, and where we were with respect to that. And that is, again, important, because when you set a milestone, it's important to be able to at least let people know where you are with respect to it, whether you reach it or are unable to reach it. Now, that said, why should people care that we're at 70 versus 69 versus 71? Honestly, our goal is to continue to increase that percentage as much as we can. And we're also not just focused on the 16 plus, we're also focused on the 12 plus, and eventually we're going to be focused on the 6 month plus number. We want to do whatever we can to increase vaccines across the uptake of vaccines across the state of Washington. The reason that there was the goal that was set by the federal government for a 70% was ultimately it was to work towards really protecting people against this virus. But it was also made very clear that it's unfortunately not it's 70% across a large swath of land like the state. But it is not reflective of what's happening in individual communities all the time. We would love for every community, not just every county, but every community, every neighborhood, every zip code, every census tract to be at 70% or above. If that's the case, then we would have a markedly different conversation about protection for people across the state of Washington. Unfortunately, that's not the case. We have some communities and counties and neighborhoods and census tracts that are well above 70. In fact, they're above 80. They're doing fantastic when it comes to vaccines. But then you also have communities that are lagging behind. And so we want to do everything we can to increase vaccines and vaccinations. And what we're trying to do is to share as much information as we can to and with our community members. So I hope that helps. Lacey, Michelle, anything you want to add to that question? Oh, Lacey, we can't hear you.
The only thing I will add, just to give a little bit of background of the science that got to the 70%, likely at the federal level and at the state level, is you can do a calculation based on the reproductive number of the virus for when you would expect to have a reasonable level of community immunity. This one is a little challenging because we have more transmissible variants emerging. So, there are experts that estimated that we would need at least 70 to 80% of the population to be vaccinated to attain that level of protection in our communities. Certainly, we want more than 70% as we see these more transmissible variants emerge, but just wanted to give you a little bit of the science behind how those numbers came about at the federal and state level.
And of course, it's a novel virus, so it's the first time we've seen this virus. So, these are the best that scientists have been able to predict. And we know the more the better. We just don't know what the exact number is because, again, it's a novel virus. I wish we had more information on that we could say this is exactly the number that it should be. So with that, Corey, are there any other questions in the queue?
We're at the end of our queue.
Would you be able to pop up that graphic again? I see it's an updated graphic around the phone number and the ways people can get to the vaccine information. So just a reminder that this is what Michelle was saying. This is all on one graphic. If you would like to be able to take this information and provide it to your viewers or your listeners or your readers, again, it's the 833 Vax Help number. It's also you can text your zip code to these two. I'm having trouble reading the numbers. Two phone text numbers, and be able to get where in that zip code vaccines are being offered. And we want to just remind everybody to go to our website. The vaccine locator tool that's there still remains helpful for being able to locate vaccines. Again, I want to just close by saying thank you to all of our media partners. We continue to make great progress in the state of Washington. Our work is not done. We're watching disease trends, and they're holding steady for now. But as we know, that does not mean that in every community that they're holding steady. You may start to see increases in clusters or in communities across Washington if we do not continue to do what we need to do to protect ourselves from this virus, which includes the mainstay right now is vaccines and vaccinations. I also want to say that we did reach the milestone of 70% for 16 years of age and above today, just right before this press briefing. But we know that our work is not done. And so we want to continue to encourage all Washingtonians to get vaccinated. And if you have not gotten vaccinated yet, this is your chance. This is your time to get vaccinated. And if you already have gotten vaccinated, please champion vaccines for others around you so you can also protect them and also make sure you protect your community. We are increasing our efforts in the community outreach space, as well as our efforts with our healthcare providers. And I think it's going to be really important for us to continue to focus on those two areas while we remain steady with the other places that we have been offering vaccines throughout the state of Washington. And with that, I just want to say thank you to all of you. We have a lot of work. It's still ahead of us, but we have made incredible amount of progress. I want to thank again Michelle and Lacey and Corey for being on. I also want to thank Lauren Jenks. She was on if there were any questions related to climate. In fact, Lauren, is there anything you wanted to say before we turn it over to Corey?
Oops. Hi, everybody. Can you hear me okay?
Yes.
Great. I will just say I was struck by Michelle's comment that the health of all of us depends on the health of the entire world. And that is true for COVID and COVID vaccines, and it is just as true for climate change. And I'm thinking about the things that we do to protect our health individually, like get vaccinated or like prepare for our homes for smoke or heat events, and things we do to protect our communities, like champion the vaccine, as you were just saying, Dr. Shaw, and checking in on our neighbors on high heat events. And then the things we do globally to make sure that this world is safe, including donating vaccine to other countries and doing what we can do here at home to reduce our emissions, like taking a bicycle more often than driving, or choosing those efficient products, whether it's a little choice that I have to make, like in hair dryers, or a big choice, like in a heat pump. Those decisions all add up, and we really do, for both for the pandemic and for the climate, need to think about how the health of the whole world impacts our health here in our homes.
Well, thank you, Lauren. That was fantastic, and thanks for bringing those perspectives and bringing it home. I really appreciate that. So with that, thank you, everyone. Corey, we will turn it back to you.
All right. I'll go ahead and close this out. This concludes today's media availability. I'd like to thank our panelists for their time today and for all of you for joining. I'd also like to thank TVW for hosting today's live stream and archives of past briefings. Likewise, you can find those on the Department of Health YouTube account. Thank you and take care.